Intermittent fasting is often discussed as a tool for weight loss, but what if it's so much more than that? Imagine a method that not only helps you shed unwanted pounds, but also revitalizes your gut, optimizes your metabolism, and transforms your overall health from the inside out. Today, let's dive deep into the core principles of intermittent fasting, focusing on its profound impact on gut health and metabolism. Along the way, we'll debunk common myths, explore the science, and reveal how this ancient practice can become a modern-day secret weapon for wellness. Let's start with your gut. Far from being a simple digestive tube, your gut is a dynamic ecosystem, home to trillions of bacteria and millions of neurons. It's often called your second brain, influencing not just digestion, but also mood, energy, sleep, immunity, and, crucially, metabolism. The health of your gut microbiome, the vast community of microorganisms living in your digestive tract, plays a pivotal role in how your body processes food, fights disease, and maintains equilibrium. But modern eating habits have disrupted this delicate balance. Eating around the clock, grabbing snacks late into the night, and rarely giving your digestive system a break can leave your gut overworked and inflamed. When the gut never gets a chance to rest, the machinery starts to falter. Inflammation rises, the microbiome becomes imbalanced, and your metabolism can slow down or become erratic. This is where intermittent fasting comes in, a structured approach to eating that introduces intentional periods of rest for your digestive system. Think of your gut as a factory. If the machines run non-stop without downtime, they break down. Intermittent fasting provides that much-needed pause, allowing your body to shift from constant processing to repair and maintenance. During fasting windows, your gut gets a chance to repair damaged tissues, rebalance beneficial bacteria, clear out toxins, and reactivate digestive enzymes. One of the most fascinating processes that occurs during fasting is called autophagy, a natural cellular cleanup in which your body recycles old and damaged cells. This isn't just theoretical. Autophagy has been linked to reduced inflammation, improved gut lining integrity, and overall better digestive health. But what about metabolism? A common concern is that fasting might slow it down, making it harder to lose weight or maintain energy. In reality, the opposite is true. When you fast, your body doesn't shut down, it becomes more efficient. Insulin sensitivity increases, making it easier for your cells to absorb and use glucose from your bloodstream. Fat burning ramps up, especially as your body shifts to using stored fat for fuel during longer fasts. Levels of human growth hormones spike, supporting muscle maintenance and fat loss. Mental clarity and energy often increase, thanks to the production of ketones, an alternative fuel source for your brain. Rather than making you weak or sluggish, intermittent fasting can make you feel sharper and more energetic. Your body adapts, operating with greater precision and efficiency. This is especially valuable for people struggling with gut inflammation, irritable bowel syndrome, dysbiosis, acid reflux, chronic constipation, and other digestive issues. By giving your gut regular breaks, you're supporting its natural healing processes and setting the stage for a more resilient metabolism. Another core principle of intermittent fasting is its ability to synchronize your internal clock, known as the circadian rhythm. This biological rhythm governs everything from sleep and hormone production to digestion and body temperature. When you align your eating patterns with your circadian rhythm, such as fasting overnight and eating during daylight hours, you help reset this internal clock. The results are profound. Deeper sleep, more energy in the morning, and a gut that functions with clockwork regularity. Research shows that fasting between dinner and breakfast for at least 12 to 16 hours can enhance the diversity of your gut microbiome, increase the presence of protective bacterial species, and reduce systemic inflammation. It's not just about when you eat, but also about giving your body the time it needs to restore balance. Of course, what you eat during your eating windows still matters a lot. Intermittent fasting is not a free pass to indulge in processed foods, sugar, or unhealthy fats. The quality of your food directly impacts your gut health. Focus on anti-inflammatory foods, prebiotic fibers like chia seeds, oats, and legumes, and healthy fats from sources like olive oil, avocado, and nuts. Avoid sugar, fried foods, and ultra-processed snacks. Think of your meals as gifts to your gut bacteria. Nourish them, and they'll reward you with better digestion, sustained energy, and a faster metabolism. Consistency is key. It's not about pushing yourself to extreme fasts one day and then abandoning the practice the next. Start gently. A 12-12 schedule, 12 hours fasting, 12 hours eating, is accessible for most people. Gradually, you can experiment with longer fasts, such as 14-10 or 16.8, always listening to your body and adjusting as needed. Intermittent fasting is a tool, not a prison. Everyone's body is different, so find the rhythm that works for you. With consistent practice, you can expect to see real results in as little as 2 to 4 weeks. Reduced bloating, improved sleep, diminished sugar cravings, more regular bowel movements, loss of dangerous visceral fat, and a more efficient metabolism, even at rest. Now, let's address some persistent myths about intermittent fasting. First, the idea that fasting causes muscle loss. This is not true if you're eating well during your feeding windows, especially if you include adequate protein. In fact, fasting can help preserve and even build lean muscle mass by increasing growth hormone levels and supporting metabolic health. Second, the belief that going without food is inherently dangerous. Intermittent fasting is not about prolonged starvation. It's a controlled, studied, and safe method for most healthy individuals. Of course, certain groups, such as pregnant women, children, or those with specific medical conditions, should consult a healthcare provider before starting any fasting regimen. Third, the notion that your gut needs constant food. In reality, your digestive system thrives on balance and rest. Constant grazing is a modern phenomenon, and it's contributing to the epidemic of digestive disorders we see today. The science is clear and compelling. Studies published in leading journals like Cell Metabolism, Nature, and the New England Journal of Medicine have shown that intermittent fasting reduces gut inflammation, increases the production of butyrate, a beneficial fatty acid essential for gut health, stimulates the renewal of the intestinal lining, and lowers the risk of autoimmune and metabolic diseases. This is the intersection of ancient wisdom and modern research, a practice rooted in tradition, now validated by cutting-edge science. So, how can you start harnessing the power of intermittent fasting for your gut and metabolism? Begin with small, practical steps. Try eating your last meal by 8 p.m. and avoid late-night snacks. Experiment with skipping breakfast once or twice a week, if it feels comfortable. Stay hydrated with water, herbal teas, or black coffee during fasting periods. Prioritize meals rich in fiber and healthy fats. Go to bed earlier and honor your body's natural rhythms. Most importantly, give your gut the quiet it needs at night. Avoid eating or snacking just before bed. Remember, intermittent fasting is not about deprivation or suffering. It's about teaching your body to thrive, to repair, and to function at its best. When you give your digestive system the space to rest, you unlock its incredible capacity for regeneration and resilience. The benefits go far beyond a slimmer waistline. If you struggle with slow digestion, persistent bloating, low energy, stubborn metabolism, constipation or diarrhea, insomnia, or even anxiety, intermittent fasting could be a game changer. By allowing your body to do what it's designed to do, heal, protect, and renew itself, you're setting the stage for lasting health. The journey to better gut health and metabolism begins with a single step. Have you tried intermittent fasting before? What changes did you notice? Did anything surprise you? Maybe you know someone who's been struggling with digestive issues or low energy. Share this knowledge with them. Sometimes the most powerful transformation starts with the simplest shift, not in what's on your plate, but in the time you give your body to breathe. Intermittent fasting is not a passing trend. It's a powerful, evidence-based approach that honors your body's natural rhythms and supports its deepest needs. When practiced with wisdom and consistency, it can bring about profound changes: lighter body, sharper mind, happier gut, and a metabolism that works for you, not against you. So, as you consider your own health journey, remember, the secret isn't just in what you eat, but in when you allow your body to rest. Give intermittent fasting a chance, and you may discover that the path to vitality was inside you all along, waiting for the right moment to awaken.